And welcome back. With a new community partnership putting the spotlight back on health disparities in Memphis, our next guest is a person who knows all too well that health care is not easily accessible for every Memphian, and especially for those living in rural or low-income neighborhoods. For more than 3 decades, the Church Health Center of Memphis has provided care for residents with few places to turn when sick. Its founder and CEO, Dr. Scott Morris, joins us now to talk more about the state of health care in Memphis. Dr. Scott Morris, good to see you as always. You and I were talking a little bit earlier. There's one thing you wanted to clarify to make sure our viewers know about. You are not retired, right?
Yes, sir. That's exactly right.
You have been very busy as always. I know you write a lot for the Daily Memphian. And one thing that you wrote about in particular that grabbed my attention was you say diversity is not a threat, it's a blessing. Why those words?
That's been my experience, and I think it's, if you really think about it, it's the experience of all of us. You know, the more we're around ideas that challenge us, I think that's how we all grow. Yeah, so, you know, diversity is important for us because I don't want everybody to just agree with me. You know, our leadership team at Church Health, number one, I don't ever want to be the smartest person in the room. And I want to be able to have ideas that we can bounce things off of, and it avoids groupthink. And it avoids just deferring to what the leader thinks.
Yeah.
That's never a way to grow an organization, a business. It's not a good way to live.
It also, Scott, has me thinking about diversity in healthcare. And obviously, we just got wrapped up speaking with Dr. Turner about Meharry and about Mississippi Boulevard, and the possibility of even more doctors of color coming from Memphis, Tennessee. Is that important, and why?
So at Church Health, we are focused intensely on the idea of growing from Memphis, African Americans who grew up in Memphis, love Memphis, go to medical school, and then come back and practice in Memphis. Currently, there are less than a handful who actually leave Memphis, go to medical school, and almost none of them come back.
Really?
Yeah, our goal is literally just 10.
Right.
10. But if we had 10 African American kids who followed the path I just told you, it would change Memphis. There are almost 2,000 physicians in Memphis. There are only about 150 African Americans in a city that is 61% African American. How can that make any sense?
And for the patients, can it really mean a difference for them, the appearance?
Look, you want your doctor to be smart, but the doctor doesn't have to be the smartest person in the room. It totally makes a difference in terms of how you connect to somebody, how you relate to somebody, how you listen to them. Absolutely, no question about it. Race matters in medicine, and that's been shown over and over again. I mean, you don't have to take my opinion about it. You know, the Journal of American Medical Association, others have written, deep, profound articles and columns and studies to demonstrate that that's the fact.
One other thing, Scott, I wanted to talk with you about disparities in healthcare, and especially as we hear about more and more cuts to Medicaid and programs like that. Where do we stand with that these days, and how challenging does it make life for many of us?
Yeah. Well, the bill that's before Congress right now, it's a little unclear as to what the outcome would be for Tennessee. But if you start delving into the bill, even though Tennessee is a state that has not expanded Medicaid, the impact of the bill would require the state of Tennessee to pay more money for our current Medicaid or TennCare programs. It would also require the state to do more around SNAP, or what people think of as food stamps.
Right.
I don't believe our state will do that. And as a result, it means many, many people will be cut from the TennCare Medicaid rolls and will be uninsured and will be coming to the doors of Church Health.
I was going to say, that adds that additional strain, does it not?
It does in Memphis, which, we are the largest recipients of TennCare in the state of Tennessee. That's not anything to be proud of. but it's a reflection of the amount of poverty we actually have in our city. Look, I'm the biggest proponent of Memphis and our being able to grow our businesses and raise people up out of poverty. And it's another issue where I think what Memphis needs more than anything are young African-American entrepreneurs. That's what's going to lift Memphis up more than almost anything else. And people have to be healthy in order to do that.
Bet they do. Scott Morris, always good to see you. Glad you're not retired.
I'm not retired.
Always good to see you. Come on back. We'd love to see you here on the 3 o'clock.